And from the minute I walked in, I could look around and I could see the quality of the practice. I'm Greg Ekdale. I'm from Bloomington, Illinois, and I'm a retired veterinarian. I've been retired now 6 years. The way that I first determined that I needed some sort of help as far as my hearing was concerned was I was having difficulty discriminating conversations, especially at the dinner table. About all I would be hearing would be the banging and clanging of the plates and everything, but it was hard to pick up on the conversations. In my work, it was sometimes hard to hear what the clients were saying to me. So those are the sorts of things that made me realize that I needed something to help. Additionally, I just found myself asking people to repeat themselves a lot. And after you do that a few times a day, you realize that there is something wrong. One of the things I think that helped me to actually seek help, believe it or not, was the fact that Bill Clinton got hearing aids. And my wife suggested to me that, gosh, if Bill Clinton can need hearing aids, maybe you need hearing aids. And I knew that I did, but I guess seeing somebody with a stature in the media and in the world of that nature that shared that they had hearing issues, that was easier then for me to seek the help that I needed. I don't remember when I got my first hearing devices for sure. I'm going to guess it's somewhere around 2005 or so not quite 20 years ago. The first time that I went, I actually utilized the services at the Illinois State Hearing Clinic. Well, one of the reasons I went to ISU is my wife was teaching there. And so it was an easy transition. And I went to that facility, and I thought the services were very good. I enjoyed helping the students with their learning and their teaching, but I found that as I continued that I was looking for a more of a relationship-based practice, which is hard to do in a institution, an academic institution like that. So while the services were always delivered, were done in a very good fashion, I found that I was seeing somebody different every time I went back. I had seen Bloomington-Normal Audiology. I'd seen the way it's presented itself to the community. I knew they were a sponsor on WGLT. I'd seen their ads in the paper, heard their ads on the radio, and I was very, very impressed with the way this practice presented itself to the community. So since I was looking for what I'm going to call a relationship-based medical provider, I decided to call and check them out. First time there was I met Dr. Sarah Hanley, and I can honestly say right from the get-go, I thought that she and I hit it off very well. One of the things that impressed me was we sat down and talked for probably 15 minutes just about each other, what our experiences were. She shared with me a little bit of the hearing difficulties that she has personally, but I could tell that she was interested in me as a person, what my makeup was, what things I was interested in life. And then once we established that foundation, moved on into the more clinical, okay, now we're going to assess your hearing and the more medical part of it. But first we had forged that personal relationship. One of the things that I like about working with Dr. Sarah is we can share pictures of our children, our grandchildren, in her case, her children. She's talked to me a little bit about her dogs because of my history as a veterinarian. So I know when I'm going in to see Sarah, it's not just getting my hearing checked, it's just kind of checking up on what's going on in your life, and I'll share with what's going on with mine. Well, I think the things that I've always been impressed with BNA as a practice, and I alluded to it a little bit earlier, is I guess I'm a factor of my age and my demographic. And when I grew up, medicine in general was offered in a very relationship type manner. And what I've seen happening is as I've sought medical care in a variety of institutions and ways, is that medicine is going very much to a team-based delivery of services where you may not necessarily see the same person each time. I think the value of a place like Bloomington-Normal Audiology is with the 4 audiologists. The way they present that is my primary attachment and my primary relationship is with Dr. Sarah, who is absolutely wonderful. But Sarah has a life outside the practice, and I realize that. And so there have been some times when she has not been there, and I've seen one of the other audiologists and they're all very good, and the delivery of services was very professional, but it wasn't Sarah. It wasn't that relationship. So what I like about Bloomington-Normal Audiology is that I have that relationship, but if something arises in a pinch, then I know that I can count on one of the other providers to provide that service. It's a practice that is a highly ethical practice. It's a highly professional practice. It's well run. The young ladies that are at the front desk and in the office, they know their job. They do it well. They explain things, and I never ever feel like I'm being rushed. I was extraordinarily impressed with the way that BNA offered their services throughout the pandemic. I felt comfortable going in there that not only were they protecting themselves, but they were protecting their patients and their clients. I think right from top to bottom, and excuse me if I say this, but I've heard the expression that fish stink from the head down, and I think Dr. McKee does an amazing job as the owner of that practice. And I'm sure that a lot of what I see are her values and the way they infuse into the way services are delivered. So I give a lot of credit to Dr. McKee, and interestingly enough, I have yet to ever meet her. Yet I think I know her because of seeing the way that practice runs. You know, it's interesting to think back on how my life is different, because as I was approaching this interview, just this morning, I was at my health club, and on the way home, I realized that I was a little bit sweaty, so I was listening to Bohemian Rhapsody on the radio. And as a little bit sweaty, I thought, gee, I don't want my hearing aids to get all sweaty. So I took my hearing aids out, and I thought, wait a second, I am missing so much of this song by not having my hearing aids. And I think that sometimes you know, like the old song, you don't know what you have until it's gone. So while I can't necessarily say a lot about what it was like before and now is after, I can tell you if I don't have them, how much I miss them, and how much I realize I am missing. And so I guess what I would say is that my life is much richer with hearing aids. And maybe that's a little emotive to say that, but I do realize that from a sensorial standpoint, there's a lot more to life than what I realized until I got the hearing aids. I guess the best advice I can give to anybody that might be resisting this is to get over it. It's not that big a deal. We sometimes put barriers in front of ourselves and cause difficulty to ourselves when we needn't. On the other hand, because I experienced it myself, I realized the emotional barriers and that you have to jump that. But it's extraordinarily painless. It really is. It doesn't hurt at all. And in the quest for knowledge and making your life complete, I think it's valuable to take care of what life has to offer and what medical professionals can offer, and certainly what Bloomington-Normal Audiology can offer. The worst that could happen, truthfully, is you become evaluated and you learn you don't need hearing aids. And you're not out anything, you know, a little bit of time. But it's, I would encourage people that are unsure is to go ahead and be tested. It's easy. Very easy.